working on the same goal and have a good way of thinking how they can reach that goal. That's a pretty good start of an ecosystem.
We invested a lot in regular communication. Trust takes time.
In the end, it is always ecosystems that do the transformation.
Ecosystems in Health and Care, the THCS Podcast.
Welcome to episode 1 of Ecosystems in Health and Care, the THCS Podcast, which takes us straight to the core, the case for change. Europe can't fix health and care piece by piece. It takes ecosystems working together, not in silos. And today's guests know exactly how the shift begins. I'm talking to Wally Keijzer, social entrepreneur and meta expert on ecosystems from the Netherlands, Gerda, Geyer, lead of the THCS work package on strengthening ecosystems at the Austrian research promotion agency FFG, who unpacks the whole initiative for us, and Anniina Tirronen from the highly successful Tesoma ecosystem in Tampere, Finland. I'm your host Ursula Esin with Red Swan Vienna, Austria, and it's my pleasure to interview the lovely guests of the THCS podcast.
So Gerda, what's the first image that comes to mind when you hear the word ecosystem?
The first picture that comes into my mind when I hear the word ecosystem is, of course, somehow a picture that is related to nature, that is related to maybe a garden or a forest where an ecosystem works together without thinking of it. And when stepping into a forest, it's more than just an assembly of trees. It's something that works together, that is interrelated in a way that you can see but also cannot see. And I think that's a very good picture also for ecosystems in the health and care systems, for example, because also there you have many things that you can see, but then very important things are also not visible.
So what's the first image that comes to mind when you hear the word ecosystem? A big word.
A big word. Of course, it's a big word. It's an ecosystem is variety of stakeholders coming together for working on the same goal. And preferably, it would be a group of people that are in the quadruple helix.
Explain.
The quadruple helix, it's about end users, it's about entrepreneurs, it's about governmental parties and parties that are related to research or education. So if they come together, working on the same goal and have a good way of thinking how they can reach that goal, I think that's a pretty good start of an ecosystem.
Now back to you, Gerda. You're leading Work Package 9 of the THCS initiative. Could you take a moment to explain what the THCS initiative actually is?
Yeah, the THCS initiative, Transforming Health and Care Systems, is a co-funded European partnership that was established by a rather huge number of countries and organizations. I think currently we have about 66 partner organizations. And we together formed a partnership with the support of the European Commission in order to support the transformation of health and care systems that everybody of us, of course, feels to be a necessary next step. Now, the transformation of health and care systems is really a huge endeavor because all the health and care systems are taken care of at the national and regional level. They are very complex systems. A lot of money goes into them, and health and care systems matter to each and every individual. So it is very complex. And what we as a co-funded partnership can do is, on the one hand, to fund projects that contribute to the transformation of health and care systems by providing new insights, by providing new knowledges, by developing new solutions, new approaches. So that's part of what we can do. Then on the other hand, we also do some kind of research activities in understanding better the gaps that are there in terms of knowledge, for example, but also in terms of the approaches that we should apply. like the policy support or the bridging of solutions and of knowledge to the policy level is really a huge task. And we have a work package that takes care of that. And work package 9 has the mission of strengthening the ecosystems, because it is the common understanding of THCS, of our partnership for transforming health and care systems, or for contributing to the transformation of health and care systems, that in the end, it is always ecosystems that do the transformation, because you need networks of actors, networks of stakeholders, networks and groups of persons and institutions and different kinds of enterprises and organizations that work together, that follow a vision and align their activities so that change actually can happen. It's never one person alone. It's not one organization alone. You really need the collaboration. And therefore, ecosystems play a huge role.
The ecosystems developed in the THCS initiative or the THCS initiative itself were an animal. Which would it be and why?
I don't think it could be an animal. It is the ecosystem itself. So it could be everything, like specimens, like the ecosystem like you have in nature, with soil, with water, with wind, with... So I don't know how the
Mycelium,
ecosystem...
maybe?
Yeah, sort of octopus.
Octopus, mycelium comes to mind.
Yeah.
Everything connected, right?
Connected,
We need a net, we need a grid. So
A network, yes.
yeah. So with us today also is Anniina Tirronen from Finland. She is part of the Tesoma ecosystem in Tampere, Finland. I've heard only fantastic things about that. I know, Gerda, you already visited the site. So Anniina, welcome, and thank you so much for being so generous with your time and being a guest on the THCS podcast. Very welcome. So Anniina, I also ask you the question, if Tesoma ecosystem were an animal, which would it be?
Maybe an ant colony, because together they can create an active society. And also, if there's something on their way, they move it away together, or then find a new way.
If the THCS initiative itself were an animal, which would it be and why?
Somehow with the picture of the garden and with the picture of the forest, I see the transforming health and care partnership ecosystem also somehow as a snake, because we are moving through the ground. But what I also like with the picture of the snake is that a snake now and then also loses the skin. And I think the renovation is also really important to be versatile, to be able to adapt to the current situation, to the needs that are there, and to evolve, to grow, and to mature. So I think those are really important aspects. We are moving on as a snake, as a wise snake also, hopefully, a learning snake, getting better, gaining more and more knowledge and insights.
Very interesting, also fits very well with the Esculapnatta for medicine, right, with the sign. So very, very interesting image. Anniina, when I understand that right, you are part of the THCS initiative. Can you remember the moment when you first thought, yes, this is the change we need?
Thank you. And yes, in this Tesoma case, I can. It was almost 10 years ago when I was working for the city of Tampere. And the city was running a wide project in Tesoma area that was developing the area's services, land use, traffic, public participation, community, etc. And there were some challenges in the area, and people living there didn't trust the city of Tampere almost at all. And we were really trying to find a new way to solve the challenges in Tesoma. And then there was, back then, about 10 years ago or almost, one winter morning, my colleague got a call from our joint boss, who was skiing in Finnish Lapland with the head of welfare services. And they asked what if we'll try an alliance model in developing services in the area. And first my colleague got inspired, Then we talked together. And after that, we started talking in the welfare services about whether this could be the change that we need in Tesoma area. And we thought that let's try it. And that was the start.
Can you remember the moment when you first thought, yes, this is the change we need?
It happened to me more than 10 years ago, because during my PhD at the University of Delft, working on a living lab setting, working with ecosystems as well, in the quadruple helix, we were really seeing that if we could put the end user in place and make sure that that end user is the one you have to focus on, the rest followed itself. So it first was
it's an
really
end
research.
user approach.
Yes, it was.
Start
Yeah.
from the end user
Yes.
and everything will follow in place.
Yes. And if you turn that around and only start with the stakeholders, then the goals are sometimes so difficult to reach. Better come back to one specific goal. How can we help out the end user? So ecosystems was part of my PhD as well. So I could do the whole tour with that.
So you've helped define what ecosystems really mean in this context. How do we prevent this term from becoming just another buzzword?
That's a very good question, because it's difficult. It's only a word that's coming up the last couple of years.
Everybody screams ecosystem now.
And that's why if you go on down under your success, if it's a buzzword. So what I think, ecosystems can vary a lot. So that it's not...
Can mean everything and nothing, right?
Yeah. And it's all about how can we make sure that the people, that the stakeholders that are on board have the same goal and working towards that. Mostly loosely coupled. It's about gentle agreements. It's not always about contracts, etc.
So what is it then?
So it is a loosely coupled group of people, but still working on the same goal. And make sure that it's not going down under their own success if there's a lot of money involved or only research is involved. So it's not about research only. You have to make concrete cases.
Tesoma brings health, social and community service under one roof. What did it take to build trust between so many different partners?
Trust takes time. And I suppose we invested a lot in regular communication between different organizations and different sectors, and also with the people in the area. So, and also it took time and a lot of enthusiastic people.
Yeah, passionate people, right? To keep the ecosystem alive. So 10 years ago, you said, let's do it together, and you're still running, right? You're still running.
And I think we are going strong.
And you're going strong. seems to be the case. It's a little bit of a pity that we cannot go to Finland and have our audience see what you're really doing there. But I think it's really interesting. Can you just unpack it a little bit for us? Is it like you have doctors together with social workers? Or is that not how I have to imagine that?
Yeah, we have people who are working in social services, in health services, but also in other welfare services, like we have a library there. And also we are working with NGOs and working with them. And in the same building, we have also commercial services. And with them, we also have some cooperation.
Anniina, in your experience, how do you keep that going? Like for 10 years, you started we all know these initiatives. I worked a lot with startups also in the health sector in Austria. Many fail. In the beginning, they are all enthusiastic, but many fail later on. How do you actually keep it going at Tesoma?
I see our alliance as a hybrid organization it is an engine for movement in the alliance, and with its different partners still going strong because we are still sharing the same purpose and the same goals that we are trying to achieve. And with this long 10 years period that we have our contract, we have succeeded or had a lot of little things that we had succeeded in. I think that's also something that keeps the engine
Going.
Yeah.
That's the fuel for the engine.
Yeah.
Yes, and do you think your alliance model, as you call it, could be a best practice for other ecosystems to have the right structure?
Well, I think so. I think we have quite a good structure.
Can you unpack a little what the alliance model really means, so maybe others can learn from it?
Well, we have the public sector, welfare county, and the city of Tampere. We have a corporation, and then we have NGOs. And these form the alliance, and we have a hybrid organization, and all these four are a part of it. And we have a board of this alliance who is steering, and still it has meetings regularly.
What means regularly? How often?
Once a month or sometimes once in 2 months. And also this regular communication and the trust that we build.
Yes, you need the communication. Otherwise, your ecosystem will probably die a slow death if you stop communicating. That's, well, we are humans, right? We have to communicate with each other. Gerda, when you look at the European landscape, what makes ecosystems the real game changer compared to isolated projects?
I completely agree with Anniina. It's the collaborative approach that really makes the ecosystem approach a good model. And what we have heard from several ecosystems that we have had a closer contact with is that they are really successful in replying to the needs of citizens, of patients, of persons. And it does not necessarily mean that you need to have more resources. It's just via a new approach, via a new combination of services, via a new combination of different expertises that you are able to reply to the needs of persons in a more fit way. And I think that's the important thing with the ecosystemic approach, that it's not a unilateral approach where you depend on the expertise just from one side, but you look at the problem, at a need from several perspectives and try to find new ways to solve it. So I think that's the really important thing. Then when it comes to the projects, of course, with my background of project funding, that's of major interest to me. And we have learned a lot in THCS in the Work Package 9 approach from previous initiative from the Active and Assisted Living program, where a lot of projects were funded, and in the last calls, an ecosystem-wide approach was also applied by AAL. And we see that it really has good results if you ask projects to take into consideration the user needs right from the beginning, from the conception of your approach, of the proposal idea. You should already be in contact with the end user so that you really reply to existing needs. And then throughout the project evolution, throughout the development of the solution of the approach, you should be in contact with different kinds of stakeholders so that you understand what is the ecosystem that my approach should then fit in, what is the ecosystem that my approach should contribute to. That's very important. And I think it's then not talking about isolated projects, but projects that are evolving into more mature ecosystems or more mature networks that actually are able to reply to needs that are there. That's the very important aspect of it. It's not that we have a project and then it ends and it is a success or it's not a success. I think projects should be much more seen as one phase in the evolution towards a new approach, towards a new solution. And also the ecosystems that we have analyzed so far and of those that have reported to us, it's always the evolution that is very important. If you look at Tesoma case 10 years ago, you will see that there are questions and needs, but you will not see the answer. Now the answer is there, and the same holds true for projects. So what we have to ask from projects is to be more open in the approach, to take into consideration the stakeholders, to try to see how their solution and approach fits into the larger jigsaw puzzle, how it could also be financed. That's something that very easily is just ignored. But you have to prepare also the finance aspect. Who is going to pay for the solution? Who is going to pay for a new approach? And then you can grow into really a viable network that in the end, at some point in time, might be a sustainable and transformative ecosystem. So the evolutionary aspect is very important. And what we have seen at the last workshop that we have organized in Vienna 2 weeks ago, where we have invited ecosystems from different countries in Europe and also THCS funded projects and national, regional and local stakeholders, is that it's really important to also bring them together so that they can learn from each other, that they break out of the own silos, break out of the own just narrow perception of what it is about, learn from the others, and can also learn to work together and to take up the experiences of others and build on the experiences of others. Like with the ants, you see a barrier, and together you might be able to remove it. The contribution or the inspiration can also come from others, from other projects, from other ecosystems. So communication is very important and was very much appreciated by the different stakeholders.
That absolutely makes a lot of sense. So, Anniina, Tesoma is definitely one of these best practices. How was it for you at Tesoma? Did you involve the end users from the very beginning, and how did you know what they needed? Or did you start with the need, maybe?
Well, yeah, because before we tried to build the alliance, there was a Tesoma program going on in that area. And one part of that project was that we were gathering the needs of the people in Tesoma, had problems that had to be solved. And then we got this idea to what if we tried this alliance model there.
And this also brings me to my next question. One myth about ecosystems you wish to bust.
That's not doable.
Without as
money.
I said, many people would say this drives me crazy. What is this?
What should I
it's
do?
It's a moving target.
I can start. Where do I have to start?
Yeah.
Start small.
And it will not work anyways.
We don't have the money, and he doesn't work with me, and whatever. So start small.
Start small.
And
one aligned step at a time.
Yes. And if it's just a small goal,
but dream big.
Yeah, of course. that's the nicest part.
So, Anniina, if you had to give one piece of advice to other European regions wanting to replicate your model, what would it be?
The process, I think it takes time and needs that communication.
Communication is key. Right. This brings me to my quickfire questions. One lesson you want every ecosystem to remember.
Build it on trust. Start building from the beginning. At first you have maybe just a couple of entities or organizations that will follow the goal where you're working on. But in the end, the good ones will stay, and the ones that don't fit into the ecosystem will leave anyhow, because then they say, oh, I can't earn money. Yeah, okay, it's not a place to earn money. It's a place to learn from each other and celebrate successes.
So we heard a lot about snakes and forests and ants today. Very, very interesting and very beautiful images. Gerda, I give you the last word. One wish for the future of health and care ecosystems in Europe you have for our listeners.
Yeah, what I personally would very much like is to see more of the really novel approaches like Tesoma did, for example, in providing health services to persons and also care services to persons, and to support people in keeping up a good health status. So the really new approaches and the surprising approaches, I think that's really what makes our effort very interesting, to be able to see that, to be able to support it in some way, to be able to act as an inspiration for persons to think about it and to try to do better, to try to do new ways, and to try to really evolve new approaches together with the citizens, with the patients, with the persons. And it does not require to invest more resources. It's more about really fitting the needs and finding new approaches. That's very interesting, I think, and very rewarding also.
It absolutely is. So thank you very much. It was a great conversation. I learned a lot about ants and bees and forests and and working together. It was just beautiful. Thank you so much for being a guest on the THCS podcast.
You've been listening to episode 1 of 6 of the THCS Podcast, Ecosystems in Health and Care, a podcast about the future of health and care in Europe, told through the voices of the people making it happen. Each episode brings together real-world ecosystems and visionary experts who are breaking silos, building trust, and transforming systems. One aligned action at a time. THCS stands for Transforming Health and Care Systems and is a 7-year initiative funded by the European Commission. This podcast is produced by THCS Work Package 9, which focuses on strengthening ecosystems, the key to tackling the complex challenges of today's health and care systems. Because collaboration is not the end of innovation. It's where real change begins. If you liked this, we have more for you. There are 5 more episodes on Spotify, Apple Podcasts, YouTube, or wherever you get your podcasts from. See you in the next one. Ecosystems in Health and Care, the THCS Podcast.